and it is an honor to see this full room. Your time is valuable. We're grateful that you took the time to come and join us to hear our brief presentation and share with us your thoughts and advice. It really is a privilege and necessity for us to get your advice and your thoughts as we think about how best to spend the public funds of Travis County to really help advance the health care of our residents with low income. Before we get into it, I want to say a huge thank you to the team that put on today's event. An event like this with delicious food and bag and this lovely environment has a lot of behind the scenes effort. And I want to thank all of our Central Health team members. Thank you for the job that you do every day. And thank you for today's event. We really appreciate it. How about now? Is this better? Okay, perfect. All right. So proposing and adopting a budget happens every year. And today we're about 3 months out from September 30th, which will be the time, hopefully then, or about a week before then, when we will have approval from the Travis County Commissioners for our budget for fiscal year 2025, beginning October 1st. And that's what we're here to talk about today. Excited to share all the things that are to come. But I want to walk us back for a moment, because the factors and the decisions that have shaped this proposal did not just arise this year. Let's go back 20 years to 2004, when voters created the Travis County Hospital District to improve the quality and efficiency of our publicly funded safety net healthcare system. Fast forward to about 2012, when Central Health went back to voters to approve the funding for our affiliation agreement that helped create the UT's Dell Medical School. And advance to around 2019, when we began the work that would lead to the healthcare equity plan that guides the investments we're making now, and factor in all that we learned as a Travis County medical system as we grappled with the COVID-19 pandemic. All of that has shaped what's in the budget we're talking about today. In prior years, we've been asked, rightly, what are we doing now to meet the critical healthcare needs that we know our neighbors with low income have, instead of planning for what we provide in the future. And I'm delighted to share, it feels really good to finally be able to respond to the people who've asked us this important question by talking about what we've done in the last 9 months of this fiscal year of 2024. Briefly, we stood up 15 new lines of specialty care and clinical support services, from podiatry to pharmacy to gastroenterology to palliative care and ultrasound and more. These are services that a lot of MAP and MAP Basic and Sendero members have simply not had available to them, without waiting weeks to months for an appointment that may come too late to help them really get better. We've opened not one, but 2 interim clinic spaces where we can see patients at the East Clinic on 2nd Street and closer to here at Capitol Plaza. And we'll start seeing patients at the completely renovated Rosewood Zaragoza Clinic in August, just a couple months away. We've ramped up medical respite care for our most vulnerable patients who lack housing where they can recover. We've opened the Bridge Clinic to address those patients' ongoing medical needs, and that's not all. These services investments have come together much faster than we had expected, because we've managed our money, your money, well, and had cash reserves that could be used immediately to speed up implementation of this healthcare equity plan. For example, that Bridge Clinic I mentioned a moment ago was slated to open in 2026, and we pulled it forward to this year because we knew how important it was working together with the homeless care, the respite care, and the transitions of care services that we had stood up. We've worked hard to build trust, to create a more cohesive identity for the Central Health system, including community care and Sendero, and to identify and solve for obstacles that keep the people we serve from getting the care that they deserve. As a system, our goal is to provide a strong foundation for a wide array of services and activities that can make Travis County a model healthy community. One trunk, many branches, is how I heard described when I was working in Africa. This sense that the trunk is our core values, what we share, what matters most, why we do what we do. And the branches is all of our diversity, the many individual strands that should be thriving and not homogenous, but connected to the whole. This is how we work as one in partnership with each other to really make whole person care happen. And this beautiful tree that I believe is the treaty oak here in Austin at least in its healthier days, represents an image of that. This is the mantra we've been using to focus as we do exciting but sometimes complex work of really meeting the broad array of our community's healthcare needs in such a dynamic and fast-growing place. Okay, is this better? And you can already see what this feels like in our new and coordinated branding structure for the Central Health System. I'll leave you with this video, which I'll click play on in a second, as a transition to the detailed work that we'll focus on today. And I thank you again for your commitment to Central Health, for being here today. We appreciate you.
For 20 years, we've worked to build a healthcare system that offers Travis County residents hope, health, and the opportunity to live better lives. Created by Travis County voters in 2004, Central Health is growing and evolving, tackling long-standing healthcare injustices and bridging critical gaps in our systems that have been around for generations. To create a better healthcare system, we must look and feel like a system. Central Health, Community Care, and Sendero Health Plans are unified and committed to using our collective strength to create a future where health is a fundamental right and everyone has access to the best care possible. This new symbol represents a big step towards uniting our system. One healthcare family breaking down barriers to better health, serving Central Texans looking for high-quality care regardless of income, whether they're in a clinic, at home, or in the community. Because healthcare is more than just treating sickness. It's about seeing each person as a whole and empowering them to live healthier lives. Together, we're making healthcare better for more than 280,000 low-income Travis County residents. United, the Central Health System will shape a future where compassion overcomes healthcare divides, strengthening our commitment to this diverse and proud community we call home.
All right, thank you. I hand over to Ted Burton, our Chief Communications Officer.
Thank you, Pat. Thank you, everybody. Also, thank you for your patience as we try to work out the audio system here. We appreciate it. I think this is the golden microphone, so I'm going to pass this around. Can you hear me okay? Great. Really quickly, before I hand it over to my esteemed colleagues, we wanted to show you this very high-level view of our strategic priorities and budget development timeline. I don't expect you to be able to read and memorize this, but I wanted to assure you that this is a process that began last spring. We had a community conversation in May where some of you may have been there, where we laid out a draft budget, high-level priorities, strategic priorities, and then our Board of Managers, and some of them are here today, spent time listening, and we're going to do that again today. So today's plan is my colleagues are going to present our strategic priorities, our draft budget, that you can ask questions as we go. Raise your hand and I'll come find you. Or at the end, we'll have Q&A. And then we're going to break up and let our Board of Managers sit with you in groups so that you can ask more questions and get feedback. So that's the next part of this process. Please know you can see the We Are Here button right there in June. There are 5 more opportunities for you to provide input on our budget, our FY25 budget. And if you got an email from us or if somebody called you today, guess what? You're stuck, because we're going to keep coming at you with opportunities to come. Tell us what you think, ask questions. We want to make sure this budget works for everybody. That's the key to what this process is all about. So with that, I'm going to hand it over to my colleague, Dr. Melinda Zabramba, and she's going to begin to walk you through some examples of where we are providing more care for more people in more places, the work that we've been doing and the work that's ahead.
I am the Associate Chief Medical Officer for Central Health, and I just celebrated my 1-year anniversary, and I will say that it's been amazing to be here and see all of the work that we as Central Health have been able to do. So as most of you know, Central Health is pretty new to direct services, and primarily we spend a lot of our time figuring out where do our patients need. We did a huge needs assessment, a gap analysis, and we expanded care initially through partnerships with organizations and practices. So a few notable things, we've partnered with psychiatric emergency services to be able to expand some of their services. We are able now to do sleep studies, and you may or may not know, so sleep studies help you look for things like sleep apnea, but it doesn't matter if you get diagnosed with that if there's no way to treat it. So the other part of that is also being able to provide the machines to treat it. We've also expanded services across both MAP and MAP Basic for cardiology. That includes seeing the cardiologist, but also being able to get the testing that is needed. We've also partnered with a number of organizations to address our substance use disorders crisis that we have ongoing, and in particular, we are also distributing naloxone out in the community. We're also expanding care through things like ENT, residential rooming, dialysis, which I think is one of the most impactful ones, because prior to that, patients who were not able to get that service had to go to the ER for compassionate dialysis, meaning they would say, are you sick enough that you may possibly pass away? If not, they'll send you home. But now those patients have a home, and I'm so thankful that we've been able to do that. We've also expanded care through oral surgery and physical therapy. So as mentioned, we contract out a lot, but the community can only do so much with the existing services. Sometimes you have to build more. And so my colleagues will talk to you more about our physical locations. I'll talk to you a little bit about our services. So we, since October, have brought up 11 new service lines and seen over 15,000 patients, 100 patients. So most notably gastroenterology. So this is very important for patients who need to be screened for things like colon cancers, and so we've been able to link people to care sooner. The wait list was approximately 1 year before we were able to get into that, and we've got it down to about 3 months. We also have pulmonology, which are our lung doctors, kidney doctors, palliative care, which is another really big and important specialty that our patients don't typically have access to. We also have infectious disease, behavioral health. We recently hired a psychiatrist, and we'll be expanding our psychiatry and counseling services. And selfishly, I'd like to point out our pre-op clearance, because that is the clinic that I run. And essentially, I just make sure that patients are safe to undergo their surgeries when they are supposed to have either a colonoscopy or just a surgery in general. Part of bringing on specialty services is also the testing that comes along with it. That includes our x-rays, ultrasound, pulmonary function testing. And I would really like to call out that at our previous conversations, it was brought up that there are patients who come in for podiatry, which is the specialist who treats basically below the knee. And so because we were able to bring in all x-ray and have it in our locations, they were able to catch an infection early and likely was able to save that patient's limb. So great work being done in our clinics.
Thank you. Good morning. I'm Monica Crowley, and I'm the Chief Strategy Officer and Senior Counsel at Central Health. And Dr. Zabramba spoke to you about the services. I'm going to focus on the additional people that we've served in the past year, and then new locations for services that have come online and are coming online. So last year, we continued to serve more people on a year-over-year basis. We served 155,685 unique individuals across the Central Health System. Next slide. We provided coverage, healthcare coverage through our MAP and MAP Basic local coverage plans to 128,373 unique individuals. And our navigation center that we opened in the past 12 months took and provided people services to over 12,000 people every single month. Looking at, and I have to use my notes for this one because we have so many new locations and new services coming online. As of August 5th, the refurbished Rosewood Zaragoza Clinic will see our first patient, and the specialty services that will either be coming online first at Rosewood Zaragoza include our cardiology practice, and also the pulmonology, the lung care, the nephrology, kidney care practice, and palliative care will be moving to that Rosewood Zaragoza site. We're also going to be providing wraparound services at that site that include behavioral health services like counseling and social work services, dietitian services, clinical pharmacy services, and the diagnostic services that Dr. Zabramba mentioned. And we also will be adding psychiatric services and endocrinology services there in the coming year. We have upcoming the opening of our Del Valley Health and Wellness Center that community care will be providing the dental and medical care services at Del Valley. And we are going to continue our planning for the Colony Park Health and Wellness Center. Also open now is the East Austin Specialty Clinic, which is where the podiatry services, the below the knee services and wound care services that Central Health provides are housed. Our Hornsby Bend Health and Wellness Center opened up this past fall. And we also have services at Capitol Plaza, which is up by the Target, kind of by 51st and I-35, where we're providing gastroenterology services, so which is anything related, from your mouth through your gut, brain health services, neurology services, our bridge clinic services that Cynthia Gallegos is going to speak about more in a minute, and then infectious disease clinics, and we will be adding medication-assisted therapy services in partnership with community care there in the coming weeks.
Monica, can I ask you a question? Would you explain medical-assisted therapy?
Oh, medically assisted therapy is when you have people who have an opioid use disorder and they can get treatment from is it Suboxone? Treatment, so they can get a medication that helps people manage their opioid use disorders. So, and it's something that is a life-saving treatment. We work in partnership with the EMS. We work in partnership with Integral Care. We work in partnership with the Sobering Center so that we can make sure that there's not a wrong door into these services, and we provide a place, a clinical place for these services. This will be an additional site where people can get access to this medication ongoing, and they can get access to counseling and other kind of wraparound services that go with medication that people, they call it induction, where you first can start getting access to that medication in another setting, and they can do a warm handoff, and then people can continue to get care in this Capitol Plaza setting. Moving on, we are moving to the part of the presentation where we are talking about our proposed strategic priorities and budget for fiscal year 2025, which is the process that we are so grateful for y'all participating in right now. And if you've been, I know many of you have been following along with Central Health's work over the past couple of years, and there are new faces in the room, so welcome everyone. And we are continuing to work on implementing our 7-year healthcare equity strategic plan, which is, it came out of a process we went through over the past 2 years, looking at doing extensive community work, doing a safety net focused community needs assessment that was focused specifically on the needs of people with incomes under 200% of the federal poverty level in Travis County, and looking at services that are offered widely across the community, and then specifically services that are available for people in, that Central Health is able to serve people who are up to 200% of the federal poverty level, and really looking deeply at who we should be serving, where people live today, where people are expected to live, at least 5 years out in the future, and then really going directly to the communities and asking what barriers are you facing in accessing care. And this healthcare equity strategic plan really is the foundation of our annual and ongoing strategic priorities, which form the basis for our annual budgets. Every year, some of the areas that community needs were identified in and that you're going to learn more about us implementing as strategic priorities in the next year. So everything you've heard about up until now in this presentation was in service of the first 2 years of the healthcare equity strategic plan, of addressing community needs and gaps that were identified. Everything you hear about in the next part of the presentation is also part of addressing these needs, or also addressing emerging priorities that we've learned about in the community since the strategic plan was completed, that also we are proposing to address in the coming year. The areas of need that were identified as part of the plan were in access and capacity. So making sure, as Dr. Zabramba noted, that we have the infrastructure, the capacity, the people to provide a sufficient level of need to high quality services, providers, and care teams, making sure that we have access to care coordination, that we're making sure that when people have to go from primary care to the hospital, or from hospital to skilled nursing back into primary care, that there is a connected way of people transitioning across the system. You don't leave with a piece of paper and good luck making that follow-up appointment, but that we have someone, system of care providers and community health workers and navigators that can help coordinate those movements across the system. And then also to the questions that just came up, one of the needs that was addressed as a high community need was really in member enrollment and engagement, making sure that we can improve enrollment in MAP and MAP Basic and any other coverage opportunities that are available for people with low incomes in Travis County and our community. And then also making sure that we are building out the whole system of care infrastructure, coordinating with partners in the community and other service providers, people like the folks at the Travis County Jail or at Integral Care, or with community-based organizations in service delivery planning, and also ultimately in the timely sharing of healthcare data.
Good morning, everybody. My name is Cynthia Gallegos, and I am the VP of Operations here with Central Health. I want to thank you all for having us and for giving us the opportunity to speak to you about the exciting work that we have ahead this coming fiscal year. All right, is this better? All right, thank you. So in FY25, Central Health will continue to put efforts in increasing access and capacity in the following areas that you see here. I'll go ahead and launch us into the specialty care clinical spaces. So in FY25, we are committed to continue stabilizing the services that you heard Dr. Z speak to a moment ago, really working to right size and ensure that service lines that have been stood up in FY24 have stabilized. As you can imagine, that takes a lot of work, infrastructure, and continued build to ensure that we've got the appropriate allocated resources. We'll also continue to work to expand services at our East, Capitol Plaza, and Rosewood Zaragoza clinics that are set to launch coming in August. And we'll continue to plan on efforts such as Hancock. Expansions will specifically focus on service lines that continue to show a high need. Examples include cardiology and GI services that really continue to have a need for additional provider resources. New service lines that will be coming online will include endocrinology and rheumatology services in FY25, and will also continue to ensure that we design and implement disease-specific interventions such as heart failure, kidney disease, and diabetes programs. Moving on to caring for the unhoused, I think Monica mentioned this or at least touched on it. We recently just launched our Bridge Clinic with a current focus on medical respite patients. This clinic is supporting high-risk patients who are needing temporary medical stabilization as they transition back into their primary care home. In FY25, we will be working to expand our Bridge services to add mobile healthcare services for shelter environments, supportive housing developments, justice-involved, diversion, and reentry populations. Mental health is another area that we've continued to put a lot of efforts into. You did hear earlier that we did launch our behavioral health services, and we'll have launched our psychiatry services later this fiscal year. For next year in FY25, we'll continue to create additional access through in-person visits, through expansion of resources, as well as really work to provide additional modalities such as virtual care visits for patients so that we can reach them where they're at. We'll also continue collaborating with partners such as Integral Care, the Travis County Sheriff's Office, Community Care, Travis County, the City of Austin, and other organizations to improve inmate health care and diversion services, including Austin State Hospital campus service planning. And then lastly, definitely want to make note that we will continue to expand availability of naloxone to prevent overdose in our community. So transitions of care is a really large space that we moved into this past fiscal year. It's an area in which we've got dedicated teams that are embedded into our skilled nursing facilities, inpatient hospitals, ED, and even in some cases our patients' homes. This coming year, we'll continue to reevaluate those care teams to ensure that they too have been right-sized so that we can reach additional patients as well as additional facilities around the community. We'll also continue to work on the design and planning of Cameron Road, our medical respite facility that is set to launch in a couple of years, along with the clinical services that will be on the same campus, which would include outpatient addiction medicine. And then I'll finish off here with primary care. So teams continue to work on the clinical services planning for our Hancock facility as well as Colony Park. This will include services such as women's health, convenient care, and dental care services. Next slide. So I know Monica mentioned this a minute ago, but care coordination has really been an area that we've continued to create, to put resources in so that we can access more patients. We've been able to do this through creating surveillance teams in our case management program, as well as disease-specific medical management teams. And really with the intention that these case management teams are really trying to reach patients that might have otherwise fallen through the cracks and or not received the care and the handouts that they would have needed. Expansions will allow for tracking patients who really just can't afford to be lost to care. They'll also be creating additional disease-specific education programs so that we can provide patients with everything that they need to know in order to manage the disease that they have been diagnosed with. I think a really good example here tends to be our chronic kidney disease population. We've worked towards leveraging our community health workers so that they can provide disease-specific education in a manner that our patients can really understand what they've got ahead of them, with the idea that we work towards trying to prevent the illness from progressing, and in that case, it would be to prevent end-stage renal disease. We'll also be launching our 2.0 of the Community Health Initiative Funds, which will focus on partnerships with community-based organizations working to address social determinants of health. And then enrollment and engagement. I know that this was something that was just brought up a minute ago. A couple of items that I'll touch on here. As Central Health, Community Care, and Sendero continue to work together to reduce the number of community care patients that are currently being seen without coverage. Together, we're working towards developing strategies to enroll uninsured patients into Medicaid, CHIP, Sendero health plans, and MAP Basic. Central Health is continuing to partner with the Travis County Sheriff's Office to provide virtual enrollment classes to individuals while they are in custody. This will allow those individuals to receive care through our clinics while they are in custody and or in our clinics once they are released. And then lastly, I know this came up a minute ago, we will continue to put efforts into working towards expanding our standard MAP enrollment to 12 months. And with that, Ken.
I'm Kim Johnson. I'm the budget director here at Central Health, and all of my colleagues have gone over all of the integral pieces that are going to make up our fiscal year 2025 budget. And so some key highlights are the beginning balance of our FY 2025 contingency reserves are estimated to be higher than we anticipated. There's a couple reasons for that. Primarily, we had significantly higher interest income than we had budgeted for, and so that higher income obviously increases our revenues. In addition to that, there were some construction delays on our clinical sites, which delayed the implementation and opening of the Rosewood Zaragoza Clinic, which will be opening soon, but we had actually budgeted for that to be open much earlier in the year. So because the reserves are higher than we anticipated, we are going to accelerate some of the clinical services that are part of our healthcare equity plan. We had planned them a little further down the line. My colleagues have mentioned a couple of those, which include psychiatry, endocrinology, rheumatology. We're adding those services earlier than anticipated in order to help us use those reserves and build up our direct care lines. In addition, we plan to cash fund some upcoming capital projects. We're budgeting $50 million this fiscal year, and we anticipate approximately $15 million next fiscal year that we'll use to fund those using cash. And the benefit of that is, in addition to helping lower those reserves, it will also result in future savings on interest income rather than if we had gone out for debt on that. And so as a result of all of those things, the property tax rate that we're proposing is a 6.5% increase above the no new revenue rate for this year. Despite having the higher reserves, the reason that we're proposing that increase is because over the 7-year plan, at the end of that time frame, that gets us to our targeted days of cash on hand, which is about 120 to 150 days of operating expenses that we have on hand. This slide shows you an example of that. On the bottom, that chart is our planned spending on the healthcare equity plan. And over the next 7 years, if we implement as expected, we will wind up by 2030 within that targeted range of operating cash on hand. Next slide. Just to give you an idea historically of what our tax rates have been, this is since the inception of Central Health. You can see the 2012 increase that was mentioned earlier. And then our tax rate has somewhat decreased and begun to stabilize a little bit in the last few years. Again, some of those changes are as a result of rapidly increasing property values, as you can also see shown on the graph. Next slide. So the impact of our proposed tax rate on the average homestead looks to increase the property tax by about $32 based on the current average homestead values. Now, these are preliminary numbers. We've not received the final certified values from the appraisal district, so this is based on those preliminary estimates that we received from them in April. Next slide. The revenue at Central Health, you can see, is primarily property taxes. In this year's budget, you'll notice that the interest and other income has gone up significantly based on what we've experienced over the past few years with interest rates remaining high. We've increased the budget based on that historical experience. So that increases primarily interest income. And then we do have a small amount of income from lease revenue and the tobacco settlement. New in our budget this year is the opioid litigation settlement. We are still waiting on better estimates of the exact dollar amount that may be. The state and the comptroller's office are working through that process of delineating that money out. That will be a restricted source of revenue, meaning that we can only spend that on items related to opioid addiction and abatement. But we did want to include that as a new source of revenue in our budget. Next slide. As my colleagues have talked about earlier, you can see that we have a significant increase in the number of services that we are providing between FY 2024's budget and FY 2025. Again, that's accelerating some of those services, but also planned services that we intended to add in this time frame. Next slide. And this final slide here is just the high-level overview of the FY 2025 budget for Central Health.